5 most important questions you need to ask your dental implant provider before getting started. Hi, my name is Dr. Alex Fedorenko and I'm implant dentist and 3-on-6 provider in New England area. And if you're watching this video, you probably have some missing or broken teeth that you're looking to replace. And it's good when you're 8 years old and you have a missing tooth, but when you are an adult and looking to get a new job or get into a new relationship, it's not that good anymore. And today we want to talk about the options of how to replace your missing teeth. Question number 5. How strong my new teeth will be. Basically, you want to know if your implant restoration will last you a lifetime. You don't want to pay for it over and over again, and you don't want to keep coming back and having the same issue with your implants like you did with your teeth. So in Metro Dental and Implant Studio, we offer the most aesthetic and the most strong material right now, which is zirconia, which can be polished very nicely, have a very nice tooth-like glance, and reflect the light the same way your teeth are. And if your dentist is offering something cheaper like acrylic or plastic or denture teeth, then with time they're gonna get duller and they can pick up some stain and wear, and it won't look as good anymore, and you'll have to replace it in 5, 6, 7 years, which adds up and builds up to the cost. Number 4. Will dentists add or remove the bone from your jaw to replace your teeth? What happens a lot of times, because the plastic restorations are so weak, surgeons end up removing the bone to make the restoration thicker. And that's why in our clinic we use very strong material like zirconia, so we don't have to do that. We can preserve your bone, we can add to your bone instead, and we can try to replace only missing teeth and don't make it worse for you and your body like your denture does. You know, during the constant wear of the denture, it damages the blood supply, it always rubs on your gum, and your bone becomes uneven, and sometimes we end up making it flat, and it helps to make your smile more even and hide the transition zone between the gum and the future restoration. Number 3. How long does it take to restore my teeth? The quickest way to restore one or few missing teeth is to just get a denture. But dentures are a temporary solution because of the permanent damage they do to your gum and bone that's underneath. And if you're still looking at this video, you're probably interested in more permanent solutions. The old way to replace your teeth is to do the extractions, then wait for healing, then place the implants, cover them with the gum. Then third surgery is to reveal the implants and start forming the gum tissue around them. And at the 4th visit, you can take impressions for the bite registration, then bite registration, and then on the 7th visit, you finally get to see how your future teeth will look like with the first set of temps. What we do in our clinic, we implement well-researched and proven ways and techniques to provide all of these services in one appointment right away after we take the teeth out, by placing the implants and giving you the provisional restoration that's made with changes according to what needs to be done during the planning period and during the planning of the surgery. And it's so much easier and so more beneficial to have one surgery instead of 3 surgeries, and getting it done with one appointment instead of multiple appointments. And just think about getting stuck once with a needle instead of 3 times, and getting 0 stitches instead of 1,000,000. And let's go to question number 2. How will my teeth and gum look like after the surgery? Will I have artificial gum or my own gum? This is the question that you want to know before, because it matters to you a lot how people gonna perceive you and look at you with a new set of teeth. And if you do the implants the old way and passively waiting for the socket to heal after the extraction and then for the implant to integrate, and then with 3 different sets of temps build out the emergence of the tooth from the gum, then it still might look okay, but it's never gonna look as good as your own gum and your own teeth that you've had. And the proper way to do it is by preserving the tissue with immediate restoration or custom abutments that fit you and keeps the same emergence as your own teeth had. And it took me 11 years to learn all of this, and I don't expect you to know this, and that's exactly the goal of this video, is to educate you so you can make proper informed decision about your treatment. And let's see what's the most important question you want to know before getting started. So the most important question you need to ask your dental implant provider before getting started is what level of education, expertise and training do they have in implant dentistry? Dentistry is a very dynamic field of medicine, and if the dentists don't stay on top of their research materials and techniques, then you end up having multiple unnecessary surgeries, sutures, bone removal and irreversible gum loss. My journey as international trained dentist began back in 2008, where I studied dental medicine in the National Medical University in Kiev. And I volunteered and shadowed experts in oral surgery in trauma center while they were putting skulls and faces back together after all kinds of accidents and trauma. When I moved to United States, I became a dental lab technician to learn the art of making teeth and making the restorations on the implants, and learn the materials, improve my hand skills, and just know the dentistry inside out through all of the processes, clinical processes and lab processes. And during my Boston University education, I learned from the best and world-renowned experts in implant dentistry: gum grafting, bone grafting, implant placement, sinus lifts, robotic assistant implant placement, and surgical guide assistant implant placements, how to convert dentures into bridges, and finally my 3 and 6 training in Utah with Dr. Roberts and Dr. Child. Thank you for sticking around for so long, and I hope you learned something new and now you can share your knowledge with somebody who's considering to replace their teeth or denture with something permanent. And you can always reach out to us here at Metro Dental and Implant Studio. We'll be happy to assist you in your journey and maybe guide you in the proper direction, and I can give you my own opinion on your particular situation and tell you what I think is best option for you. Feel free to call us for a free consultation, and we'll be happy to assist you in any way we can. Thank you so much.